Ma'am, we have been hearing some alarming news over the past few months about what people getting depressed and people getting more anxious because of what's been happening. Not just because of the lockdown, but as well what we can expect for the next few months or even years. People are parang, in limbo. What have you noticed? What are the numbers that you've been noticing, for example, as far as your foundation is concerned?
Well, this lockdown and then what's happening with the pandemic, which is the illness of coronavirus causing us a lot of death, is a major concern for the whole world. We have a 37% rise, increase in depression, anxiety, panic attacks, insomnia all over the world. That includes the Philippines. I can share with you a data that I gathered the past 4 months through the Hope Line. We have the
Mhm.
Hope Line, and our calls have increased by 200, and there are weeks we increased by 220%.
Wow.
So currently, our calls are about 72 to
Mhm.
138 per day, and
Mm.
50% of those calls are due to the COVID lockdown and the uh, the COVID mortality rate. So we
Mhm.
are
Ano
dealing
pong
with
demographic profile?
okay, we're dealing with different age group. What's interesting is we never had such a big age group of seniors calling us, but right
Oh.
now we have about 32% seniors calling, and they are locked in an apartment condominium by
Oh
themselves
yeah.
with one
Mhm.
Mm.
helper.
Oh,
And then they
yeah.
have children all over the world. Some are in New York, Australia, some are OFW, some are nurses, some are doctors. And they really feel the loneliness. And then
Oh.
a few of them that reported they're on medication. So you cannot really say that um, they are really healthy at the healthiest peak of their lives. So they're on medication, they have chronic illnesses, and they are alone,
Mhm.
sometimes with a nurse, with one nurse and a helper in a condominium. So it chooses also no social status. We have callers who are grandmothers, and then they are very concerned about their own lives because they're living in very tight quarters, and there's about 12 of them in a tiny house. On the other hand, we have wealthy, retired people calling us up, a lot of widows, a lot of women, more women than men.
I'm just curious on your side. Do you have the manpower to deal with a 200+% surge in calls?
That's a very beautiful question. Thank you for that question. We need support. We really do. Right now, I have 14 responders and 5 doctors. The five
Mm.
doctors are available for a 20-minute phone call for free. The foundation pays the doctors an honorarium for a 20-minute assessment. And then it's up to them to ask the doctors if they want a professional treatment via telephone, via Facebook,
What kind of
FaceTime.
what kind of volunteers are you looking for? Because I
Um,
imagine that they would have to be trained at the very least because I mean taking calls from depressed people, especially
yes,
those inclined toward taking their own lives,
yes.
that's
Okay,
a
Luchi.
very, very
The
risky thing to do,
the
right?
support I need are not from volunteers, but it's from large companies. Like I need help
Okay.
from San Miguel, like I need help from big companies that are helping COVID, because my you have the frontliners who are taking care of sick patients in the hospital, but you can consider the responders. We have 14 to 16. You can consider them as auxiliaries. And since we're working also, we're planning, we have a project with OWA. And if it does continue for the OFW abroad, we're so lucky because Globe gave us 8 trunk lines, and they gave us an international line where the OFW can call the
Now,
Philippines.
Ma'am, I mean, you mentioned that a lot of these people who call, they do have families, they do have relatives probably abroad. But at the same time, there may be people here, and we don't realize that our relatives, that our loved ones are struggling with something. What can we in the household and in the families be more aware of, na baka pinagdadaanan ng mga kasama natin?
Actually, it's just a matter of being mindful about our relatives. Like, for instance, I have a 92-year-old aunt, and I personally feel like I should call her more often. And me, I live quite alone. I'm a widow myself. So it meant a lot to me that my sisters abroad were calling just to check how I was. And
Mm,
so the the kindness and the thoughtfulness within the family, to
right.
your cousins, to your aunt, to your grandparents, mean a lot, especially if the calls come from little children, from their
Oh,
grandchildren, from
yes.
the
Yes.
5 year
Mm,
old or the 12-year-old. I
Yes.
hope that the parents remember their parents, their older parents who are within 60 to 85 years old, because that is where our callers are now. And it's shocking that about 25 to 30% of our callers are widows who live alone. Actually, I got teary eyed when I saw the report from Hopeline. And in Hopeline also, we need to add, thank you for your question, we do need to add about 8 to 10 responders. And I'm looking for funds. So I'm just happy if I could get some funds on the GCash campaign that Globe started for us 3 days ago. And it does not matter how much. I just
Mm,
want to collect 1 million Filipinos that will give something, and I can tell the 110 million Filipinos, 1 million Filipinos care for you. That's
okay.
more important than the amount.